name is Russ Roberts, and I'm here today to talk to you about a community risk reduction program that we feel the Tampa Bay area needs very much so, and it is a mobile integrated healthcare system. In today's short public service announcement, we will be telling you the reasons why we feel we need this mobile integrated healthcare system, who it will benefit, and how it will benefit us as an entire community. We will also talk about the problems and how we feel we will mitigate through those problems. The main goal of the mobile integrated healthcare program is to bridge the gap between the emergency department and the hospital and their primary care physicians. People are overusing the emergency department for all their needs. Patients need more help once discharged from the hospital, and what we need to do as a community is to help relieve the burden on the patient and the EMS community by having a healthcare program that can go to the patient. This will help free up hospital beds. This will make emergency rooms wait times go down drastically. Why? Because they're not being overrun. Emergency rooms are understaffed and there's just not enough room. And this is because most people aren't educated in a way of having care past their emergency room visit. We can help to ease that burden by sending someone to them, helping them be more involved without having to go to an emergency room for all of their primary care needs. What does this do for the EMS and the healthcare community? It should help reduce hospital readmissions to provide the correct guidance for the next step in treatment, rather than using EMS and tying up emergency room services, leaving them open for actual emergencies. In this next slide, we will show you how the patient's emergency room will the patient's engagement will increase, while the overall care cost will decrease. ER utilizations will go down by a projected 21%, while communication rises by a staggering 97%. Overall patient experiences rise, while the crowding and cost will go down. This is because there's a direct communication with the patient and even someone coming there to do their home health care. That's why we need this, so ERs can take care of emergencies. People will become more educated and have the services that they need. How are we going to mitigate these risks that are involved? We will establish an MPC or a model performance criteria. This will drive the focus for all the risk reduction programs and help fire departments measure their program values to a desired outcome. Everything will have to be calculated and recalculated and done, and finding the best way for not only nurses, EMS, physician's assistants, doctors, and inpatient surgeries by having them coming to the patient and establishing when they need to be seen, how they will be seen, and what will happen when they are seen at the facilities. This isn't a question of if we need this. It's a question of if we don't start establishing it now, where will we be in 5 years? Where will we be in 10? How many emergency rooms will the city of Tampa need to have just in order to keep up with the rising calls and the overcrowding of these emergency departments? Our stakeholders are going to be everybody within the EMS field and emergency medical services altogether. Doctors, surgeons, pediatricians, everyone that can be seeing their patients at home. This is why we need this. This is what we will do by implementing it. We will have to have many stakeholder meetings, a hiring process, which will increase for jobs, but it will also keep our emergency rooms open and help people become more active in their own healthcare roles rather than just being confused. My name is Russ Roberts. Thank you for your time today. I hope the slides were helpful. If you need anything, you can reach me at rush.roberts@tampagov.net with any questions or concerns that you may have. Thank you and have a wonderful night.